Hi, good morning everyone. I'm THANALETCHMY PARASURAMAN. Good morning, Dr. SAMINATHAN. Today I'm going to present about diabetes mellitus. Next, move to the next slide. Okay, this one is table of content. These are the parts included in my chapter. Okay, next we move to the introduction to the diabetes mellitus. So diabetes mellitus is the chronic metabolic disorder, and diabetes mellitus is a long-term condition marked by elevate the body sugar level, and it also occur due to the insufficient insulin production or body ineffective use of the insulin. Chronic hyperglycemic can lead to the serious health complication, including the heart disease, kidney failure, and nerve damage. Okay, this one is the example which is based on normal blood glucose and also the highest blood glucose in the blood. Okay, next we move to the next slide. Okay, the next slide will be the definition and type of the diabetes mellitus. Diabetes mellitus is the metabolic disorder characterized by the chronic hyperglycemic resulting from the attack in insulin secretion and insulin action or both. So type 1 diabetes is the autoimmune condition where the body attacks the insulin producing by beta cell in the pancreas and leading to the little or no insulin production. So the type 2 will be a condition where the body becomes resistant to insulin or does not produce the enough insulin, often associated with the obesity and the sedentary lifestyle. So the last one will be the gestational diabetes, a form of diabetes that occur during the pregnancy and unusual resolve with the childbirth, but increase the risk of type 2 diabetes later in the life. So mostly the gestational diabetes is happen to human when they are in the during the pregnancy time lah. Okay, this is the differences between the type 1, type 2 and gestational. For the type 1 is considered autoimmune disease and require insulin to life, not preventable, but some research show that avoiding exposure to the virus can help reduce the risk, and regular vaccination and wellness visit are important. So the number 2 is insulin resistance can lead to the elevate the blood sugar, and many people that having type 2 suffer and underlying the health problem can be preventable by eating healthy and staying active. And the last one will be the gestational. This one is occur during the pregnancy and caused by the combination of genetic and environmental risk factor. So the blood sugar typically return to normal after give birth. Okay, this one is the pathophysiology of diabetic mellitus. Type 1 is the immune system attack the pancreatic beta cell, leading to the complete lack of insulin production. So the type 2 will be the insulin resistor occur in muscle or fat, liver cell, and the pancreas initially produce the more insulin to overcome the resistance, but over time the insulin production is decreased. So the picture is described about the pathophysiology which is happen between the organs. The first one will be type 1 diabetic mellitus is destruction of the beta cell of pancreas leading to insulin deficiency, and type 2 is impaired insulin secretion leading to insulin resistance, and it lead to reduction of the glucose utilization and enhance the lipolysis, enhance the protein catabolism. It lead to the insulin deficiency, and it also lead to the hyperglycemia. Okay, next we move to the next slide. Okay, this one is prevalence of diabetes mellitus. Is based on Malaysia. Malaysia is non-born in the Asian for the diabetic. The show that percentage of population aged between 20 to 79 who have diabetes in each country as 2021. So 19% is Malaysia, 11.6 is Singapore, and 11.1 is Brunei. Indonesia will be 10.6% and Thailand will be 9.7. So overall Malaysia is highest. So the risk factor of diabetes mellitus is start from genetic and family history. A family history of the diabetes increase the risk due to the genetic predisposition, and the specific gene associated with the diabetes can be inherited. So the obesity and physical inactivity also another one key point, which is excess body fat, particularly around the abdomen, increase the insulin resistance. So the number third will be the age, risk of type 2 diabetes. The pancreas with the age, especially after 45, aging is associated with the reduced insulin and production and increase the insulin resistance. The last one will be the poor diet. So the diet high in processed food and sugar and unhealthy fat can lead to the obesity and insulin resistance. So beside that got a picture, have a look the picture. Start from the diabetes mellitus, and it can cause because of the factors such as alcohol, smoking, lack of the physical activities, body mass index, blood pressure. It can happen because of the age and also the gender. Okay, next we move to the next slide. Okay, next is causes of diabetes mellitus. So the insulin resistance is first. The body cell become less responsible to insulin, leading to the higher blood glucose level, and it's associated with the obesity, physical inactivity, and poor diet. Second will be the autoimmune response. Type 1 diabetes, the immune response attack and destroy the insulin production beta cell in the pancreas, and triggered by the genetic and environment factor including the infection. Number third will be the genetic mutation. So the specific gene mutation can impair the insulin production or function, and also it include the MODY. It means the maturity onset of diabetes of young, and pancreatic disease. Conditions such as pancreatic cancer and cyst fibrosis and damage to the pancreas lead to the reduction in insulin production and secretions. So the causes of the diabetes mellitus, have a look based on the picture beside. The type 1 diabetes mellitus is destruction of the insulin production beta cell of the pancreas, which also known as autoimmune system or autoimmune disorder. Type 2 diabetes is insulin resistant to the muscle tissue, which is liver and fat cell. The increase in the body weight, overweight or obesity, decrease in the physical inactivity, and last one is the hereditary factors. Okay, next one is the sign and symptoms of the diabetes. Is based on the frequently urination. It also known as polyuria. Increase the glucose level lead to the excessive urine production as the kidney attempt to the expel the excess sugar. The second one will be the excessive thirsty and polydipsia. So high blood sugar level cause the hydration, triggering and intense thirsty. Unexplained weight loss. Despite normal of increased appetite, the body cannot effectively use glucose, leading to the blood, fat and muscle breakdown for the energy. The last one will be the fatigue. Inability to use the glucose for energy results in the persistent tiredness and weaker. Okay, beside that got a picture. This also describes the symptoms of the diabetes. It include blurred vision, gastric, abdominal pain, nausea, vomiting, urination, polyuria, and glycerias. Systemic weight loss, respiratory, breath, smell, and also central nervous system based on the polyphagia. These are the main symptoms of diabetes. It also is common symptoms of the diabetes. Okay, next one is the stages of diabetes mellitus. It starts from the normal glucose tolerance. It's based on blood sugar level are normal, and the body efficiency uses insulin. No sign for the diabetes in these stages. And insulin resistance, cell become less responsible to the insulin and often due to the factor like obesity, inactivity. So the body starts struggling to keep body sugar level normal. The third one will be impaired fasting glucose, IFG. The blood sugar is level higher than normal after fasting, but not higher enough to be classified as diabetic. This stage indicate the pre-diabetic. So the number 4 will be impaired glucose tolerance, IGT. The blood sugar level rise more than normal after eating. Another pre-diabetic condition signaling and increase the risk of developing diabetic. So the last one will be the increased insulin production. The pancreas work harder to produce more insulin to overcome the resistance. Blood sugar level are still maintained within the normal range at this stage. Next, we move to the next slide. Okay, this also continue with the stages of diabetic mellitus. Beta cell dysfunction, the insulin production cell is the pancreas start to fail and leading to gradually decrease the insulin production. The blood sugar level begin to rise. The next stage will be the hyperglycemia. So the persistent high blood sugar level occur as the body can no longer manage the glucose effectiveness. These mark the earlier stages of diabetic and diagnostic of the diabetic. Diabetic is confirmed through the medical tests such as the fasting glucose test and the oral glucose tolerance test. So the blood sugar level are consistently above and diagnostic threshold. The last one will be the progression of complication. The long-term high blood sugar level can cause the complication affecting the nerve, heart, kidney and cardiovascular health. This complication is derived from prolonged uncontrollable diabetes. Okay, this one the picture is explained about the stages of diabetic mellitus. Okay, it start from the type 1 diabetes. It start from the genetic risk and immune activation, immune response, and then it's go into the stage 1, stage 2 and stage 3 is based on the beta cell decline. Okay, beside picture is explain about the 5 stages of type 2 diabetes. The first one will be the stage 1 type 2 diabetes is based on insulin resistant and is lead to the pre-diabetic and formal diagnosis and complication begin in these stages, means the 4 stages, and the last stage will be the advanced diabetes complication. So the stages will be, first one will be the insulin resistant, the stage 2 will be pre-diabetic, the stage 3 will be the formal diagnosis, the stage 4 will be the complication begin in this stage, and also the last one will be the advanced diabetic complication. Okay, next we move to the next slide. Okay, in this slide we going to discuss about the diagnosis of diabetes mellitus. It start from the fasting glucose test. Is measure the glucose after an overnight fast, and a fasting blood glucose level of 126 or higher or 2 separated occasionally indicate the diabetes. So the second one will be the oral glucose tolerance. The measurement glucose before 2 hours after drinking a glucose rich beverage. A 2 hours blood glucose level of 200 mg or higher indicate the diabetes. So the third one will be glycerate hemoglobin HbA1c test. Is reflect the average blood glucose level or the past 2 to 3 months, and HbA1c level is 6.5% or higher, or 2 separate tests indicate the diabetes. So the fourth one will be the random plasma glucose test. Is based on the measure glucose without regard to when you last ate. So a blood glucose level of 200 mg or higher along with the symptoms of diabetic indicate the diabetic. So the next one will be C peptide test. This one is measure the level of C peptide in the blood, which indicate how much insulin in the has been produced, and the lower level may suggest type 1 diabetes, and where highest level may indicate type 2 diabetes or insulin resistance. So the last one will be the autoantibody test. Is detect the autoantibody that attack the insulin production cell and positive antibody suggestion type 2 type 1 diabetes. Okay, next one will be the urine test for ketones. Check the ketones in the urine, which is by produce the fat breakdown, and fasting insulin level test. Measure the amount of the insulin in the blood after fasting. So the lower level indicate the type 1 diabetes. Higher level suggests the insulin resistant, and the last one will be the rapid lipid profile, which is measure the cholesterol and triglyceride level. Okay, next we move to the next slide. Okay, this one is a diagnosis of the diabetes mellitus based on blood sugar and HbA1c test. Okay, this one is the treatment of the diabetes mellitus is based on lifestyle modification, is based dietary challenges and physical activities. Oral medication is based on metformin. First line treatment for the type 2 diabetes, which is reduce the glucose production in the liver and improve the insulin sensitivity. And sulfonylurenase is stimulate the pancreas to release more insulin. And DPP4 inhibitor is increase the insulin release and decrease the glucagon level in the response to meal. So number 3 will be insulin therapy. So this one include the short acting insulin, which is used before meal to control the blood sugar spike, and long acting insulin provide a steady level of insulin through the day and night. So the insulin pump delivery the continuous insulin infusion and mimicking the normal pancreatic function. So the last one will be non-insulin injectable medication, GLP-1 receptor antagonist. So this one is enhance the insulin secretion and suppress the glucagon, slow the gastric emptying and promote the satiety. So amylin analog is slow the gastric emptying, decrease the glucagon secretion and also increase the satiety. Okay, this is the continuation of treatment based on diabetes mellitus. Blood glucose monitoring, self-monitoring of the glucose, regular checking of the blood glucose level to manage and adjust the treatment, and continuous glucose monitoring provide the real-time blood glucose reading and trend. So second will be the weight management, MATRIC surgery option to the observed patient with a type 2 diabetes can result in significant weight loss and improve the glucose control. Education and support, diabetes education program takes self-management skill and including the diet, exercise, medication adherence and glucose monitoring. The next one will be the blood pressure control and anti-hypertensive medication used to maintain the blood pressure within a large range and reduce the risk of the cardiovascular complication. The last one will be the cholesterol management, which is statin and other lipid lowering agent is used to manage the cholesterol level and reducing the cardiovascular risk. Okay, this one also the continuation based on treatment and diabetes mellitus is regular checkup, health and checkup, food exams, regular screen for the neuropath and other food complication, high examination, annual checkup to detect the retinopathy earlier, the kidney function test monitoring the nephropathy, and the last point will be the stress management is based on the mental health support and relaxation technique, which is practice like meditation, like yoga, deep breathing, exercise, or reduce the stress level. Okay, this one is the treatment of diabetes mellitus. Is the differences for the diabetes type 1 is include rapid acting, short acting, intermediate acting, long acting, and ultra long acting. So different type of insulin got different type of onset and peak and also the duration. Okay, next one will be the type 2 diabetes mellitus. Okay, the treatment is include the lifestyle modification as we discussed just now, balance the diet and exercising. Next one is the medication, the oral and insulin. Okay, the medication based on the oral and insulin. The third one will be the glucose monitoring is based on the HbA1c test and finger stick. Okay, next we move to the next slide. Okay, this one is the drug classification for the diabetic mellitus. So first one is the biguanidase. Example is the metformin. The mechanism is metformin. Okay. The mechanism will be the decreased glucose production by the liver, increase the insulin sensitivity, use the first line treatment for the type 2 diabetes. Second one will be the sulfonylurenase. The example is glipizide, and mechanism will be stimulate the pancreas to secrete the more insulin, is used in the type 2 diabetes to improve the blood glucose sugar control. And thiazonidines TZDs is pioglitazone. The mechanism will be the increased insulin sensitive in the fat and muscle cells. Is used in type 2 diabetes to enhance the glucose uptake. The fourth one will be the DPP4 inhibitor. Sitagliptin is the mechanism will be increase the insulin release and decrease the glucagon level in the response to meal. Is used in type 2 to improve the glycemic control. The fifth will be the glucagon like peptide 1 receptor antagonist. So the example can be the exenatide. So mechanism will be the enhance the insulin secretion, suppress the glucagon, slow the gastric emptying and promote the satiety. So it's used in type 2 diabetes and often with the weight loss benefit. Okay, next is number 6, which is based on sodium glucose co-transfer inhibitor. Example is canoliflozin. Is increase the glucose secretion through the urine. It used in the type 2 diabetes to lower the glucose level and reduce the cardiovascular risk. So number 7 will be the alpha glucoside inhibitor. Example is acarbose. The slow the absorption and carbohydrate in the intestine. So number 8 will be the magnetides. The example will be the repaglidine and stimulate the rapid short-acting insulin secretion for the pancreas and use in type 2 diabetes to control the blood sugar and meal. So number 9 will be amylin analog is pramlintine. Slow the gastric emptying and decrease the glucagon secretion, increase the satiety. So it's used in type 1 and type 2 diabetes and adjacent to insulin therapy. The last one will be the insulin, which is example like rapid acting, lipros, short acting, regular, intermediate acting is NPH, long acting is ghrelin, and the mechanism is displaced to the supplement natural insulin to regulate the body glucose and used in the type 1 and type 2 diabetes for glycemic control. Okay, next one will be the management of diabetes mellitus. Is based on lifestyle modification, healthy eating, emphasize a blood balance diet with a whole grain, lean protein, fruit, vegetable and healthy fat, and also regular exercise per week such as brisk walking, cycling, swimming, like that. Second is the blood glucose monitoring, self-monitoring of glucose, regular checkup of the blood glucose and level using the glucometer to manage the adjust treatment. Continuous glucose monitoring CGM provide the real-time blood glucose reading and trend, helping to the fine-tune insulin to medication dose. Number 3 will be the medication management. Is based on the oral medication including biguanides, sulfonase and thiazolidinase, D44 inhibitor and etc. Non-insulin injectable insulin therapy. Number 4 will be the weight management. Is based on dietary counseling and behavior therapy. This works with the dietitian to develop the weight loss plan and support to adoption the maintaining health, eating and activity habits. So number 5 will be the education and support. Diabetic education program and text self-management skill including the diet and exercise, medication adherence and glucose monitoring. Okay, this one is the management of diabetic mellitus. A4 A1C test, B is blood pressure, C is cholesterol and no smoking. So this one is considered as management of diabetes mellitus in common. Okay, next one will be the complication of diabetes mellitus. Cardiovascular disease is increased risk of the heart attack, stroke and atherosclerosis. So it's caused because high blood glucose level can damage the blood vessel and nerve and control the heart. So neuropathy is nerve damage, is numbness, tingling, pain, weakness usually in the hand and feet. So it can happen because of high blood sugar level can injure the nerve throughout the body, particularly in the extremities. So next one will be the kidney damage. Is reduce the kidney function leading to kidney failure and end stage renal disease requiring the dialysis or a transplant. So number 4 will be the eye damage to the eye, blood vessel in the retinal, leading to the vision problem and potential blindness. So it happened because of the high blood sugar level can cause the retinal blood vessel. Number 5 will be the food damage. It because increase the risk of the food ulcer infection and potential amputation, and also is caused because of the poor blood flow and neuropathy can lead to the several food infection. The last one will be the skin condition is increased the risk of bacterial and fungal infection such as boil, trail, athlete foot and ringworm. Okay, this one is the example of complication. Is start from the cerebrovascular disease, permanent kidney damage, diabetic foot infection, peripheral nephropathy, and heart attack, retinopathy, and blindness. Okay, the last one will be the conclusion and takeaway. The conclusion is the chronic disease with a high blood glucose due to the insulin issues and include type 1 and type 2 and gestational diabetes. So the significant health risks can be cardiovascular disease, neuropathy, nephropathy, retinopathy, and more. The takeaway need to yearly detection, recognize the symptoms, frequently urination, thirsty or weight loss or fatigue, something like that, and use the FPG, OGTT, and random glucose test. Second one will be the life modification, have to maintain the balanced diet and regulate exercise. Number third will be the medication management, is adhere to the prescribed medication and monitor the blood glucose. And number fourth will be the regular checkup, need to regular checkup, and the written exam for the eye, kidney, feet, and the blood pressure and glucose. The last one will be the education and support for the diabetes education program and also the support groups. Okay, that's all for this chapter. Thank you.